So I'm curious about your work, partly because we know each other and I've been hearing about it for a while, but also because I had no background, kind of learning this before I went into having kids. And everything I've learned has been through the process of working with babies and new parents and having lactation consultants around me and doulas. So did you get into this work because of interest you had in helping new mothers? Or was it a challenge on your end as a parent? How long have you been doing the doula work?
Well, I too had pretty much not much knowledge or knowing anything about birth or babies going into my pregnancies, and I didn't have many friends who had already had babies by the time I did. So,
Okay.
and I was not in this field at all. I was in education and anthropology and was following a different path.
Oh,
And
wow.
once I got pregnant, I started learning a little bit, but basically followed the lead of my OB, who was quite lovely and young and smart. And I had met her, in order to be my OB. I wasn't working with her before that. And I went for a walk with a woman in my building fairly late in my pregnancy, probably 30 something weeks, 30, 31 or 2. And she had just had her baby, and she told me her birth story, and she was walking with her baby, I think in a carrier, and I was walking with my baby in my belly. And she told me about her birth at a birth center attached to a hospital in New York City, and about her doula. I didn't know much about doulas at the
Yeah.
time. In fact, I might have never heard the word before at that point. My kids are now 19 and 16. So this was 20 years ago. And so I listened to her story, and I heard about this amazing team she had. She took a childbirth class. She had a doula. She had these great midwives she was working with. And she was going to be at the same hospital as me because that's where this birthing center was. So I went to my OB, my next appointment, and I said, I've just learned about the birthing center at the hospital. I'm so excited to birth there. Can we plan to do it there? And she just said, "Oh, that's such a great idea for your second baby, but for this first one, just leave it up to me, and we'll be fine in the regular part of the hospital." And I was sort of floored. I just had never thought that there would be I would be sort of shut down, but like that
Yeah.
when I was asking
Yeah.
questions about birth. Now that I was so interested and excited about this
Right.
particular way of feeling very supported, and being able to sort of work for a physiologic birth, which I didn't know that term at the time, but working my
Yeah.
body and my baby working together to have this process happen.
And then it wasn't presented to you as even an option,
No,
until you figured it out for yourself.
yeah. Exactly. So I think I went back to this person who was, a friend, acquaintance in my building, talked to her about it. And she said, "Why don't you meet the midwives?" And so
Hmm.
I went to an open house that these midwives were having, and I really liked them. And they were able to take me on at 30 something weeks pregnant, which at this point, it would be harder to do, but there are some practices that will do that. And I certainly advise people now, if
Right.
they find
Right.
that they're in the wrong relationship, to do that.
Yeah.
So I switched practices. I hired her doula, kind of copied her, had a very different
Hmm.
birth from her, but
Yep.
one in which I felt supported and respected, and, that I had a shared decision-making kind of situation.
Yeah. And I happen to know your second as well. So
Yes.
how did the second birth go?
Yeah. So at that point, I had learned a lot in the process, but I then had my son 3 years later. And by then had become more intrigued by birth, learned a lot more about birth, and was with these same midwives and who I had been with before, a different doula, but I loved the second doula as well. And his birth was much faster,
Hmm.
and I sort of knew a little more about what to expect along the way, and I was able to use a lot of comfort measures, and I was able to be with the team, and I felt extremely empowered. And it was a very beautiful, inspiring experience. Also, easier physically for multiple reasons, but
Right.
just was something that really inspired me. And after I had him and in this birthing center, which I had originally planned to be in with the first one, which I did end up being with the first one, even though it was a very different birth. But then I was home very quickly after that birth so that we could be with my daughter again. And I couldn't really let go of birth at that point.
Hmm.
We weren't planning to have more kids, but I wasn't ready to be done with birth. And so I thought a lot more about birth during that first year of his
Hmm.
life. And at one point, my sister, who is totally not in the field, said, "Why don't you look into being a doula?"
Yeah.
And so I did. I looked into it. I talked to a bunch of different people, signed up for a doula training, and was really quite hooked by the first day of that initial training, and went on to be certified as a doula, work as a doula for about 7 or 8 years, and then sort of started to make a transition to teaching childbirth education. Was doing both for a while, and have done other types of birth work, including postpartum work and lactation work, all of those postpartum doula work,
Yeah.
all of those being things that I can do on a schedule where it's more predictable and not where I'm leaving at 3 in the morning.
Right. Right.
Um, but now I'm mostly teaching childbirth classes.
Unlike our midwife friends.
Exactly.
So what was it? Do you have any sense of what it was about birth? Was it the process? Was it the way that you felt you were able to support, or what was it about that drew you?
Well, in my own births, I think it was the experience of seeing how incredibly powerful the experience of birth is, and the sort of making of a mother, making of a parent, and
Hmm.
that transition that happens from having this baby, growing this baby inside you through the process, not just
Yeah.
then having the baby on the other side, but through this process of your baby, my baby at the time, and me working together
Yeah.
to make this incredible experience happen, and bring her and then him into the world. Um, it's just an incredible and amazing experience that hadn't gotten my attention before, and certainly doesn't get
Right.
the attention of a lot of people, including a lot of pregnant people, until they are 30 something weeks pregnant and start to
Right.
pay attention to it, and then start learning and think, wow, I've got so many choices and options that are available to me that I hadn't even thought about before. And then there are, of course, some people who never see that and end up either being satisfied with their births or not. But
Yeah.
um, yeah, basically education and preparation, once I realized the value of those in preparing for birth, made me realize this is something that I want to be a part of. And at first that took the form of supporting people because my doulas were so supportive to me during my births. And I loved being able to do that work and being able to witness birth so many times. It was
It's pretty.
really
Yeah.
amazing.
I don't get to see the births, but I do. I mean, I a lot of times I'll do prenatal work with the mother and, see the baby afterwards. Actually, I just treated a baby yesterday that mom had a really difficult pregnancy and even got sick on my table like at the end of her pregnancy. It was just, but she was nauseous like her entire pregnancy. Just one of those very difficult pregnancies, but the baby has been really easy. So it's like, as you say in your materials, like every experience is going to be different, and it was so interesting to see how easy this baby was, and also having worked with the mom, while he was in utero, seeing how responsive to my voice he was. she was
Mm.
she was commenting right away, like he just got calm as soon as you started talking. Did you notice that? And I hadn't even touched him yet. So there is, and just to kind of maybe lead this into like, the community of support that's needed around this. And I've been fortunate enough to be part of that community. Was that something that also you felt like, oh, you started to see who all these different people were, and how you worked together?
Yes, I was lucky with my first to have a postpartum doula as well, who was wonderful. So that was my introduction, having my
Yeah.
doula, my birth doula and my postpartum doula and these midwives who were very supportive, learning about that, how important that support is, and getting the lactation help that I needed with my first. Then when I actually started to do birth work and had the honor of being present and sort of supporting people through their own births, then it was just the most rewarding thing to be able to be someone who could be there at one of the most important times of people's lives.
Yeah.
So being able to be that support person at that point, and then being able to connect them to people who could support them further, whether it's lactation help or mental health support,
Yeah.
postpartum doulas, because at the time when I first started, I wasn't doing that work as well. So being able to make all of those connections to people, to other birth worker people who could support my clients was pretty incredible.
Yeah.
And since I've been in teaching, connecting pregnant couples with each other. And that happens both in person, which is how I used to only teach, and on Zoom, which is how I've been teaching mostly for the last several years since COVID started. Although I'm now also teaching in person, but the online classes continue. And
Yeah.
even when people are in different states, there is a
Mm.
connection that can come after several weeks of, being on Zooms together, where they share resources. And, in addition to the resources that I share with them, including people like you,
Yeah.
um, they share with each other. If they're in the same place, they can share practitioners, but also just sharing resources, sharing ideas. So I love
Yeah.
that there is that community.
Yeah. And I mean, I think you must have also felt that, like, for whatever reason, you had a real, like, ability to be this grounded person for new parents, because that was one of the things that was surprised me about myself. Like, I didn't realize I had that as a resource, because I'd been working kind of with individual adults for a long time, and I'd treated a few kids, but never like a family, especially in a family with going through a challenge, and I felt like very good about that process. So that was, for me, that was a surprise.
Yeah, I think you're right. That comes as a surprise and something that hopefully you're proud of. And as
Right.
you
Right.
pointed out to me, yes, that is something that I feel very good about.
Yeah.
Yeah.
So where do you start then, in terms of this kind of childbirth education? Can you kind of take us through some of the basics? You tend to start with people, like, is it before they become pregnant, after they get pregnant, some combination of that, in a group setting probably? Do
Yeah.
you do you work with single parents? I'm just kind of curious about where this all starts.
I wish, as do many of my colleagues, we wish that it would start before pregnancy,
Uh,
so that people could learn about what their options are for choosing their care provider, which is probably the most important thing as you're
okay.
leading into your birth.
Well, hopefully this will
And
help people maybe be a little bit more proactive.
yeah, so I was talking to somebody about this the other day. I've had people who others have referred to me who have moved from Europe or, outside of this country, who will call up and say, "Hi, I've just moved to New York. What are the kinds of things I should think about? I'm either just pregnant or I'm planning to get pregnant. So I'd like to set up a care team." That's so great.
Yeah.
That is, and evidence-based birth, which is the curriculum that I've been teaching a lot lately, has a particular class that is geared toward people who are either mostly very early in their pregnancies, to start getting them to think about what their options are, and particularly the importance of choosing a care provider who you are aligned with.
Yeah.
But that is much more rare, I find, here in this country. And hopefully that's changing and people are starting to think about it earlier, because people are talking about birth a little more. But the media representations of birth as just something where you go into the hospital and push out your baby with a lot of screaming and
Yeah.
not a lot of context. Those representations persist. And so it is not everybody who sees and what birth can be
Yeah.
and who understands, the physiology of birth, labor and birth, which then sort of empowers you to understand how your body can do this amazing work and
Right.
how important it is to have a supportive team with you to help that process along and not just to sort of take over and run it.
Right.
You know?
So evidence-based, I'm guessing, means really looking at like the physiology, the science behind, what we already know, and just the kind of, I'm sure the basic mechanics of like how your body does something, who the people are that you are going to encounter in a hospital. Is it all that kind of stuff?
Yeah, I mean, so Evidence-Based Birth is a website that Rebecca Decker started. She's a nurse with her PhD, and she started it basically for friends. You can hear her story because on most of the podcast episodes, she has a great podcast. On
Okay,
most of the
cool.
podcast episodes, she starts off by just giving her little blurb about herself. So she started it just for friends in
Hmm.
terms of who wanted to learn about birth and wanted data and evidence on sort of what the best practices were rather than just saying, okay, you walk into the hospital at however many centimeters, you should be this far along. If not, you get this intervention, et cetera. Instead,
Yeah.
what is the evidence behind all of this? So started out
Ah,
small and has really grown a lot. And then she developed this evidence-based birth, childbirth class curriculum, which is what I'm teaching now, which can be taught. It's a 6-week curriculum. I often teach it as a 5-week curriculum, combining
okay.
2 of the sessions in the middle, which works well for a lot of people who haven't planned out that they want to take a 6-week class.
Right.
There are those who plan early and start early, which is wonderful, but we want to accommodate everybody. So the class really starts by focusing on the physiology of labor, make sure that people understand the hormones of labor,
Hmm.
how your body and your baby work together to make use of the space available in your pelvis and what's actually happening during this rotation and descent of your baby, and all the ways that your baby is proactive in the process as well with the cardinal movements through birth. And then, and by the way, this is a lot of videos and reading that you do at home, and
Okay.
then you come to the class sessions for discussions. So
Okay.
it's the flipped classroom approach, and I feel like I'm more of a mentor than a teacher, not
Yeah, I
just sort
like that a
of
lot.
not just handing people information, but here, you learn this stuff, and then let's all
Yeah.
discuss it and ask
Yeah.
your questions. And yeah. So after that, then we talk a lot about the sort of what evidence-based care is, what evidence-based birth is. And it really has to do with, knowing, and she provides a lot of evidence and data on her website about the different interventions, about best practices for mothers and babies. And so that people can understand, why am I being induced for my due date? Is that something that can be applicable to everybody? What are due dates? How are they what are they based on
Right.
anyway?
Yep.
Looking at what kind of care you're getting, what kind, who's actually in the hospital if you're having a hospital birth, like you were just saying,
Yeah.
who are all these players? What are their concerns? And then looking at making sure that you have access to the evidence, that you have a provider who practices based on the evidence. And then the third stool of this 3-legged stool of evidence-based care is your values and choices, and making
Hmm.
sure that you have the opportunity to ask all of the questions and get all of the information you need to make the choices that work for you. So that if I have a class of 6 couples, they can get all of the information they need about the way birth works, the way that
Hmm.
different interventions in the hospital may or may not work, the way that different practices in the hospital work. and then make their different choices. And they're probably going to be different from each other. Some will think the same, but some are going to
Hmm.
read everything, see everything, and make a completely different choice than somebody else. And that's great.
Oh, that's awesome.
Yeah.
I love that. So, are you do you do mostly groups then when it comes to this stuff? Do you do one-on-one education as well, like more of like consulting?
I do both. I teach the evidence-based birth childbirth class um, either every other month or every month. I do a series and usually have 5 or 6 couples in those. I don't go higher than 6 because it gets a little unwieldy because those are all still on
Yeah.
Zoom.
Okay.
And they will probably continue on Zoom because it works really well like that. And because I have people from all over. I have a couple, I live in Brooklyn, New York, and I have a couple from South Bend, Indiana in my current class.
Okay.
And it's great to
Yeah.
hear about what's going on over there.
Yeah. Yeah.
Um, and and then I also do individual work. I just did a 2-session series with a couple who had a baby 3 years ago, had a cesarean after a lot of hours of laboring and trying to have a vaginal birth. And now they're planning a VBAC and a vaginal birth after cesarean. And so they wanted a refresher. And we went
Yeah.
into it thinking that they wanted a refresher on comfort measures. And then we started talking about advocacy and the kinds of things that had happened last time that had made them feel that they weren't as supported in their
Ah.
birth situation. And so we ended up doing one session on advocacy and her partner was really wanted to know specific things, what could he say at what times, what's the language that he could use? And that's the kind of thing we work on in the evidence-based birth class.
Yeah.
And then the second session we did was about comfort measures. But that actually, I had talked about where the evidence-based birth class goes after we sort of cover things about choosing your care provider and making sure that you have a care provider who is going to be aligned with your particular way of thinking and your approach to birth and your ideas about how you would like to labor. Choosing a birth setting that will work for that. Then we go into, what are the things that might happen during your birth? What if you're having a hospital birth? What are the interventions? What are the benefits, risks, alternatives for all of those interventions?
Hmm.
And how can you make sure that you're getting care, you're getting informed consent, that informed consent is being respected and followed.
Yeah.
And
Yeah.
so, and also making people understand, making sure people understand that informed consent means also the ability to do informed refusal. So informed
Mm.
consent and understanding sort of what questions to ask to make sure that you're getting the best care is all a part of that. And then going through interventions and then also going through, what happens postpartum and with breastfeeding for those who are breastfeeding and people and other alternatives to that as well.
And
So,
and what kind of just I'm curious about advocacy because a little bit because of the experience I went through with my daughter who had meningitis at 12 days old, and we spent a month in the hospital and some miscoordinations going on, and some, we had to have a PICC line put in at one point that went into her carotid, and they sort of told us this was the person they needed to wait for. And then when we got there, they were like, he's the only one in the hospital that does these things. And then we got there and he's first time doing it. And there were like a lot of things like that went on in the hospital. And I was really frustrated at the end of like that whole process. And I said something that apparently scared them because I said, I need to make sure this gets, noted some way that I was told this thing, and this is what happened in the situation. And immediately they sent an advocate to the room. So, and you know what? Our entire, I mean, this was like a week into a month, and our entire experience changed from that point on. From the choices and nurses we had coming into the room to like the communication that was going on through the whole thing, it completely changed. So it made me realize that like, oh, I didn't even realize I had a voice in this scenario.
Wow. I am really glad that you spoke up, and I am horrified that it took your speaking up like that for the care to change to something that looked a lot better for you
Yeah.
and your family.
Thanks. Yeah.
Um, that, but that advocacy part of it is, in the birth part, in the part leading up to having your baby, in addition to postpartum, immediate postpartum, whatever it is that comes up for people, is something that for many people, because many people are pleasers. Like, we want to be their
Hmm.
favorite. We want to
Yeah.
be, not rocking the boat. So,
Right.
um, practicing advocacy is part of it, advocating for yourselves to be able, we learn all of the sort of ways that you can help yourself with comfort and all the alternatives for comfort measures. But it's no good learning those if you were going to arrive at your place of birth and you are going to be told to stay in the bed with monitors on the whole time, or
Right.
you're going to be told that you can't get up and do the kinds of active things that you were planning to do in order to make yourself feel better and to, help with gravity and movement of your
Right.
baby
Or
inside
just
you.
be uncomfortable or suffering in any way and feeling like, well, this is, I guess, what the experience is supposed to be like.
Yeah. So partners learning to advocate for you with, specifically role playing and trying different things so
Right.
that
Yeah.
you can,
Yeah.
I play the nurse and or the OB, if in the case of people not feeling as comfortable with their care providers, I'll play the nurse out over Zoom, and I'll, come in and say I want to do a cervical check
Hmm.
and be insistent about that. And the partners will have to practice their advocacy
Hmm.
because their person doesn't want that right now. And
Yeah.
so, how are you going to convey that to me with kindness and love? The different tickets that you have to learn communication skills.
Yeah.
You don't, if something gets to the point of we are not being treated well, she is not being treated well, and we need to stand up and say no, that's rare, but then you need to
Hmm.
be able to say no. But normally it's just standing up for what will help her, and what will help her to be able to follow her birth plan. We talk a lot about birth plans. I'm a huge
Hmm.
advocate of writing up what your birth preferences or plan are. And so practicing and also having a doula. So having a birth doula, I mean, there are lots of studies showing that having a doula in the room will reduce your risk of cesarean because of lots of different things, including doulas being able to help you to stay home as long as possible and not arrive at the hospital if you're planning a hospital birth until you're further
You're really,
along
yeah.
and less likely to have as many interventions. And also supportive care, emotional support, and advocating for you once you're at your place of birth
Yeah.
and reminding you or your partner to advocate for yourselves.
Hmm.
So those kinds of things are super important. And then it and these are also skills that will continue for the rest of your life, the rest of your caretaking life in terms of your kids, and also for yourselves in other medical or other situations. So I've learned a lot from teaching the evidence-based birth class in terms of advocacy that I use in daily life as well.
Yeah. So in terms of planning, are there like kind of very specific basic points that you feel like people need to get solid on, and then ones that they obviously like, best laid plans, things are going to
Yeah.
go in different directions. But are there ones that you try to get people to be really solid about before going?
Choice of care provider.
Choice of care provider, which is why
Yeah.
the earlier the better.
That is truly the best. I mean, the biggest thing, because if you have a care provider who you feel comfortable with, who you feel respects your very large role in this birth that's about to happen, and will help you to do the things that think are important in terms of your comfort and your movement and all of that. If you have that person lined up, then you are going to have a better experience.
Yeah.
No matter what comes your way, that person is going to be there to help you understand your options along the way, so that if it does come, most births are not an emergency situation. The vast
Right.
majority of births are not an emergency situation. But if it does come to a need for an intervention, then if you have somebody who you've had good communication with throughout your pregnancy, who you can feel aligned with, then if that person says, okay, now we need to take this action, then you can
Yeah.
feel confident that it's truly needed and that it's not just a routine use of a procedure that might have been avoided.
Yeah.
So choice of care provider is the crucial thing. And sometimes, I have people in my classes who come to the first or second class and then email me for, at least the New York people, email me for suggestions for changing care providers.
Okay.
So it is extremely important. So I think that's the most important thing. And then other than that, really learning what your, physical and emotional and sort of mind body options are for comfort, practicing so many different things, including, breathing and visualization and relaxation and all kinds of comfort measures and techniques, so that if once it comes time for your birth, you and your partner can choose from all of them. And maybe one thing you thought was going to be great turns out to be something you don't want at all. But that's
Right.
okay, because you have X number of other things in your tool bag to pull out and use.
Yeah.
And all those things that you can do at home, as well as understanding the options that are available for you for medical support in the hospital, if that's what you choose.
How much do you get into like self-care, or other kinds of maybe non-traditional care for pregnant mothers? Because I've done a lot of not as much these days, but like 10, 15 years ago, I did a lot of work with a lot of prenatal movement work with women, and so and with expecting dads as well. and I felt like there was something really important about that as it related to recovery as well, but also just for some of the physiological stuff that happens during the pregnancy. I was just wondering if you
Yes,
if you go into that stuff.
absolutely. I very much recommend and send resources about and links about exercise, pelvic floor work that you can do,
Hmm.
ball exercise or birth ball work that people can do, and, giving them specific links and videos so that they can work on things and practice things that will help with their, alignment, with their pelvic floor strength. And I plant a lot of seeds about having, doing body work. And
Sure.
I talk about craniosacral therapy a lot, both for people who are getting ready to have their babies and for babies once the babies
Yeah.
are born.
Yeah.
I talk about, I talk about you. I talk about the importance of alignment, pelvic alignment, and also of what happens when the baby comes out and the baby has trouble breastfeeding, or,
Hmm.
can't turn their head a certain way, that these are not just things to ignore, think, oh, this is a normal baby thing, but no, this is
Yeah.
something that we can work on,
Yeah.
so that there are resources. I talk about pelvic floor therapists,
Acupuncture.
and acupuncture and acupressure. Acupressure is actually part of, so that partners can do it themselves.
Oh, that's awesome. Yeah.
Training in
Cool.
acupressure is part of the course that I teach. And so, yes, I talk a lot about body work, and and some people's insurance will cover these things. And so
Right.
I
Right.
definitely recommend that people look into their insurance and what they can do both for themselves before having their babies and after birth, for themselves and for their babies.
And a lot of doulas. I mean, most doulas have some kind of they learn some techniques for like acupressure techniques, but there are a lot of doulas I know that are also massage therapists, and so they'll work both, sort of prenatally if there's stuff that comes up. Sometimes there's like, as like stuff that happens around the tailbone or on the sacral area. A lot of sciatica becomes sort of a common thing towards the end of the pregnancy, and
Yeah.
then stuff comes up during delivery too. I mean, that's the other thing that it's sort of to have someone there with skilled hands during that time can really sort of alleviate things too, without having to, use medical pharmaceutical intervention.
Absolutely. I mean, for New York, I have people that I recommend to people for massage, for craniosacral work, for acupuncture, and for chiro work. I'm
Yeah.
very picky about my chiro suggestions. Uh, I mean, all of the suggestions, but
Yeah. Yeah.
and then in other places, I either look up or I ask for references to other instructors who live in other areas to try to get people the resources they need. But, really sort of, it's something that a lot of people haven't thought about. I didn't think about it. I didn't know about it when I was pregnant. And so
Yeah.
these are the kinds of things I wish I had known about. And
Yeah.
so, trying to help people learn about all of these options available to them to help them be as prepared, physically for birth as possible.
And how far into the education, like as part of the programming, do you also go into some of the postnatal, post birth work as well? Is that something that's part of the coursework?
So for the evidence-based birth course, the last class is half of it is a labor rehearsal.
Okay.
And then the second half of that class is looking at the materials for that week, which are about postpartum planning and breastfeeding,
Okay.
and
Okay.
really emphasizing the importance of postpartum planning. And part of that is making sure you have the resources you have, including people's names,
Yeah.
for lactation help, for body work, for mental health services, et
Yeah.
cetera.
Yeah.
And part of that is just making sure that people understand that the two of them do a lot of things that they're not going to be able to do or won't have time to do once they
Yeah.
have the baby. And that once they have the baby, her job, the birthing person's job, is to take care of the baby and take care of herself. So that means whatever she was doing before needs somebody else to do.
Right. Right.
And partners are needing to support the new mother and the new baby in their job of only feeding and recovering. So
Yeah.
who's going to do all of that work? So making sure that
Hmm.
people really sort of look at it concretely and say, are we going to have the support we need? Who's going to cook for us? Who's going to clean? Are we going to plan in advance? Are we going to have a meal train? How are we going to get all of this in place to make this as smooth as possible, given that postpartum realness is real?
Yeah. And
Then
to have difficult conversations sometimes that you might not realize are going to be difficult conversations before the baby's born, like with grandparents or with other potential care providers, so that you know sometimes you don't need all of the support, but sometimes something just happens and then all of a sudden you need all hands on deck, just that they know that that's kind of going to be that they're part of the game plan, and that you're getting an agreement basically that yes, I'm up for this.
Yeah, absolutely. And we're the same age. I don't know if you grew up with Free to Be You and Me.
Oh yeah.
Yeah. So, that song about some kind of help is the kind of help that helping's all about, and some kind of help is the kind of help we all can do without. I always think this in my head every time we're
I
talking
love
about
that.
this, because, and I don't usually use the quote, but making sure that people understand they need to differentiate, who's coming to help and who's coming to visit. And
Yeah.
you want the helpers, not the visitors.
Yeah. And there are some generational things that are like, sort of unsolicited advice things that became the norm for certain people. And I hear this a lot in my practice. Like my mother-in-law keeps thinking this should be the way things go, or they don't understand breastfeeding, or, and because it wasn't part of their process, it wasn't part of that generational process. So I think in some ways it's if you have that plan in place that you're working on, you can start to share it with those care providers, and there's like a pretty clear, I mean, a lot of this is about kind of managing setting boundaries and sort of managing the environment that you're about to go into too.
Yeah. Yeah, absolutely. So getting people to think about that, and they're supposed to write. I mean, for homework, I don't, enforce it entirely, but they are
You don't
supposed to
grade it.
write. a postpartum plan and really be paying attention to all this. And I send resources and they get resources as part of the class that sort of help to point out the kinds of things that people cover in a postpartum plan, but really, encouraging people to write it down.
Yeah.
Yeah.
So I don't know that much about postpartum doulas. Can you explain that really quickly? Just like what that role is and how long that goes for?
Yeah, I mean, it varies on both what the role is and how long it can go for. Some people, usually there's a package that postpartum doulas will have of certain number of hours that
Okay.
would be at least 6 and sometimes a lot more than that.
Okay.
And that could be, 3 2-hour sessions, or as I said, many more. And postpartum doulas vary, just like doulas, birth doulas who will vary in terms of what their specialty is. You might have a postpartum doula who's a trained massage therapist. You might have one who's a lactation counselor. I mean, everybody who's a postpartum doula has some amount of lactation training, but some have gone further with that than others. And there are some who are wonderful chefs who will help with nutrition and, meal planning, and even cooking for you. And if you have another child already, there are some who are going to help out also with sort of that transition for that child and
Hmm.
helping basically any way that she can help a new parent transition as well as possible into
Yeah.
this new role and coach you on basically
And physically recover too, right?
physical and emotional recovery. So
Yeah.
it might
Yeah.
be like,
Yeah.
how do you do this first immersion bath? Once the
Yeah.
cord stump comes off, like, how do we do this? Or massage for the birthing parent who needs the kind of thing that you were just talking about.
Yeah.
Or lactation support. Lactation support is a pretty big one. And then
Yeah.
if you have something that needs, that they're not trained for, that needs more clinical attention, then referring you to an IBCLC or somebody who's, got more letters behind their name in terms of lactation
Yeah.
support.
And we're going to have one on the podcast here as part of this series. So
Right.
we'll kind of go into that too, which will be good.
Yeah.
Um,
And referring people to, craniosacral therapists. That all of that is part of what postpartum doulas will do. But basically, helping
mm,
you to make that transition and feel supported along the way.
yeah, I feel like it's another piece that I feel like I tend to be part of that, and sometimes I see people who haven't had a whole lot of support, especially if it's a single parent. um, but just not they don't have quite enough support around them for the emotional components of what's going on. And sometimes it's just having a very, simple exchange to be able to express like I'm struggling with this thing or whatever. And that's really how I'm sure those postpartum doulas, or, in a lot of cases too, lactation consultants will then say, okay, now we need to branch out to this next, resource, because that's how we know. So that's part of the reason for doing the series was I wanted to make sure that people understood there's a lot of resource sources out there. And I noticed on your website is yourpreparedbirth.com. Is that right?
Yes.
And I'll put that in the show notes so people can just link right to it. But you have a ton of resources in there from everything from like websites to different apps that you can use and any of that kind of stuff. Is there anything that of that list maybe that you can share real quickly, just like a couple of them that you pretty much always recommend?
A couple of them that I recommend. That's hard. It is a very
There's a
long
lot.
list. Yeah, it's a long list. And I aim to continually update it. But although, most of the ones, especially in that first section, which includes evidence-based birth, it includes lamaze.org, I think Childbirth Connection. Basically, there are a lot of sites as you go further down that list that are more specific. Like there's a breastfeeding
Right.
section.
Yeah.
But those top resources that really have great information and evidence-based information on sort of most topics in
Yeah.
childbirth, pregnancy, childbirth, and those ones are probably the key ones I would look at to begin with. I mean, really,
Okay.
if you're, yeah. Um, And then if you're specifically looking at, the perinatal mood and anxiety disorders, then sort of skip down to that lower part.
Gotcha.
But
Okay.
yeah, I
And
guess I,
it's pretty well organized down there. I was just wondering if there's any of them that for you, you're like, make sure you check out this website or make sure this book is in on your shelf or any of that kind of stuff.
yeah. Well, yes, I always advise people to read The Birth Partner by Penny Simkin, especially partners to read The Birth Partner.
Okay.
And so, and, love Penny Simkin's resources and always refer people in my classes and anybody really to her work. And yes, there are a lot of amazing books and resources, and some will appeal more to other people, and some will appeal,
Okay.
to others. So I basically try to just list a lot. And the other thing is, I was certified by Lamaze to teach childbirth classes, and their 6 healthy birth practices are the way that I don't specifically teach them in the evidence-based birth class because that's not how it's structured, but they all are, they all come through. In other classes that I teach, I also teach for Boober in New York City, and I teach their in-person classes. And I always list through what those healthy birth practices are and, where they come from, what they mean, and always advise people to look further into them on the website because they really are a way to structure your preparation and education about birth. So,
Okay.
I find Lamaze and evidence-based birth are both just looking at what are the best things that you can do for the best outcomes for mothers.
And just kind of a good place to start for overview of what you're about to and then you can, depending on what what you feel challenged by, you can kind of go into specific areas and research more.
Yeah. Yeah.
Cool.
I mean, there's so much now that you're asking me. There's Sarah Buckley in England. She's incredible. Sorry, there's Sarah Buckley in Australia. There is this woman, Sarah Wickham, in England. So there are people all over the world. And so, yeah, I try to keep as many resources as I can.
And a lot of that's on your site. So we'll just direct people to your site. But I was just curious to see if there was anything that you felt like really specific about.
Yeah.
Well, cool. Yeah. Well, thank you so much for taking the time to do this. I feel like this is one of those things that I've been wanting to do for a while to try to get this resource to the surface. I know I've just over the last year, as you were putting things together, I was starting to see like, oh, this is stuff that I feel like I've been wanting to get to. And I a lot of times what I'll do is when I get a parent in who doesn't have very much resource, I'll direct them to like your site or to other places. So it's just, I mean, you've done amazing work for people already. So I appreciate that. And for me, so thank you for doing that. And thanks for taking the time to do this with me.
Thank you. I've completely enjoyed speaking with you. And I'm so grateful to have you in my life and my son's life as, our craniosacral therapist. And of course, I wish that I had known you from when I had my babies, but you live and learn.
Yeah. Oh, thank you. It's been great working with you guys. I appreciate it.
Yeah.
All right. Thanks, Jen.
Yeah, absolutely. Talk to you soon.